there's definitely going to be changes in the healthcare delivery system. We can't just continue to squeeze providers to say, okay, well, this is how we're going to save money. It's forcing healthcare providers, whether they're doctors, hospitals, nurses, you name it, into some very different actions that, in most people's opinion, is unhealthy. And at some point or another, Chandra, we have to be responsible, or have a part of the responsibility of what's going on. Way too often, people just pull out their insurance card, and it's like, I don't know the difference between and cost between an X-ray, an MRI, or a CT scan, right? I might make a little different decision if I did know what some of those costs were, and those costs came back to me. That's why I think HSAs, health savings accounts, having pools of money that we put in as individuals and as families really can help us try to keep some of those costs down, because it forces you into making a decision of, it's like, okay, I just had it. My youngest son went racing out the front door on his way to go to jump on the trampoline. I thought he was going to get injured going to the trampoline. He got injured on the driveway to the trampoline, fell, broke his arm, and we weren't sure what was going on. It was in the evening, and so I splinted it up and we wrapped it up, and the decision was, okay, do we go to the ER? We thought it was a sprain, but weren't sure. Took every precaution, and decided to go in the next morning. I mean, the cost difference. Certainly, if he had been more seriously injured, we would have taken him in. That doesn't become part of the question. But when it's those types of things, do you keep your child home from school and take them the next morning to the doctor because of a cold or a flu or something like that, versus taking them into the emergency room? If you don't have any cost difference, you'll make different decisions. So there's going to be some shifts, and I get it. Shifts are uncomfortable.